What is Tecfidera used for? Tecfidera is a medicine used to treat multiple sclerosis, MS, a disease in which inflammation damages the protective insulation around the nerves, demyelination, as well as the nerves themselves. It is used in adults and children from 13 years of age with a type of MS known as relapsing-remitting MS, where the patient has flare-ups of symptoms, relapses, followed by periods of recovery, remissions. Tecfidera contains the active substance dimethyl fumarate. How is Tecfidera used? Tecfidera can only be obtained with a prescription, and treatment should be started under the supervision of a doctor experienced in treating MS. Tecfidera is available as capsules to be taken by mouth with food. The dose is 120 mg twice a day for the first 7 days, after which it is increased to 240 mg twice a day. The dose may be reduced temporarily in patients experiencing side effects of flushing and gastrointestinal, stomach and gut problems. For more information about using Tecfidera, see the package leaflet or contact your doctor or pharmacist. How does Tecfidera work? In MS, the immune system, the body's natural defenses, malfunctions and attacks parts of the central nervous system, the brain, spinal cord and the optic nerve of the eye, causing inflammation that damages the nerves and the insulation around them. The active substance, dimethyl fumarate, is thought to work by activating a protein called NRF2 that regulates certain genes that produce antioxidants involved in protecting cells from damage. Dimethyl fumarate has been shown to reduce inflammation and modulate the activity of the immune system. What are the side effects associated with Tecfidera? The most common side effects with Tecfidera, which may affect more than 1 in 10 people, are flushing, reddening of skin, and gastrointestinal problems, such as diarrhea, nausea, and pain in the abdominal area. These side effects tend to start early during treatment, usually in the first month, and may continue intermittently throughout treatment. Tecfidera must not be used in patients who have or might have progressive multifocal leukoencephalopathy, PML, a serious brain infection that has been associated with some MS medicines. For the full list of side effects and restrictions with Tecfidera, see the package leaflet. What benefits of Tecfidera have been shown in studies? Tecfidera has been shown to reduce the risk of relapses and how often they occur in adults with relapsing-remitting MS. In a main study involving 1,234 adults, the proportion of patients who experienced a relapse over the course of 2 years was significantly lower with Tecfidera treatment than with placebo, a dummy treatment, 27% versus 46%. In a second main study involving 1,417 adults, patients were given Tecfidera, placebo or another medicine for MS, glutamer acetate. This study showed Tecfidera to be more effective than placebo in reducing the number of relapses over the course of 2 years. The number of relapses per patient per year was around 0.2 with Tecfidera compared with 0.4 with placebo. The number of relapses per patient per year for glutamer acetate was 0.3. A main study involving 150 children and adolescents aged 10 to 17 years compared the effects of Tecfidera with interferon beta-1a, another MS medicine. After 2 years of treatment, around 13% of children taking Tecfidera had no new or newly enlarged lesions, damaged areas, in the brain, compared with around 3% of children in the interferon group. Since there were very few 10 to 12-year-old children in the study, it was not possible to determine the safety of Tecfidera in these young patients, and use of the medicine is therefore recommended from the age of 13.